First of all, thank you very much for inviting me as the presenter today to this webinar, and also thank you everyone for attending this webinar. So today's talk is about non-destructive 3D histology with X-ray phase contrast tomography. So first, I will give you a little bit introduction to Exciscope, who we are, where we are, and then I continue with giving an introduction to histology analysis and our special solution as X-ray phase contrast technique for that, and the requirements for hardware and software, and then I will share you some application examples. So we are a company located in Stockholm. The idea derived from a PhD thesis from KTH University, and we are now scientists and industrialists that we are following the same goal, that is providing synchrotron-like performance X-ray imaging techniques for especially soft materials to a broader range of users. So hopefully people don't need to wait 6 months for receiving a time. Yeah, so what we are offering is basically X-ray micro-CT system, as well as we are offering X-ray imaging service for phase contrast imaging, and we provide service on the existing systems in the market for our customers, and we also support other customers that they would like to make basically their own laboratory-based systems, and especially if they use Excelom sources. So, an introduction to histology analysis, which is a study of microscopic structures of tissues and cells in organisms, and it is providing a lot of information, especially when it comes to cells and like human cells or plant-based cells, and it involves usually slicing the samples and studying on based on the optical microscope, and it gives information about the tissue structure, cell morphology, and abnormalities, such as disease, infection, and tumors. And this information can provide some knowledge that how tissues function and how disease affect them at a cellular level. So the most common histology analysis that people are using or researchers in biomedicine are using is optical microscope, and it provides actually a good resolution in transversal direction. However, it involves quite distractive sample preparation involving slicing and staining the sample, that basically changes the nature of the samples in some cases, and it is also limited vertical resolution. It is limited to vertical resolution to a few micrometer, as we need to slice the samples in some thin layers. So when basically destroying a sample is not an option, we can think of other types of histology analysis, which X-ray virtual histology is one of them. And it is basically a non-destructive sample preparation, and it doesn't destroy the sample. So it is possible to run the sample analysis even after you run the X-ray analysis on the sample. And it also provides isotropic micro and nanometer resolution in different directions, as well as information in 3D volume and data volume. So it is possible to virtually slice the sample later and get information from the sample in different direction. So here I would share an example of comparing optical microscopy and phase contrast micro-CT on human coronary artery. And it shows in both cases that the artery lumen is surrounded by the muscle tissues and also with the fat tissues. And the only thing is that for the optical microscope, the data is basically limited to two-dimensional. And also it is a distractive sample. It involves distractive sample preparation. So it's not possible to actually look into the sample with other techniques later. So On the other hand, phase contrast micro-CT, it can provide the good contrast between different components, and also it can provide the 3D volume and the 3D rendering and the volume data on the samples. You can see basically the outline of the vessels and also the calcification distribution alongside the vessel. And even you can do further simulation and see how the blood flows through the vessel. Another example here is the micro-CT imaging, phase contrast micro-CT imaging on rat bone. And you can see that there are some small holes on that represents the vascular canals. You can virtually slice this sample, these images, and see the image in different directions. And also you can run volume data on a specific segment, on a specific component, which here is the vascular canals. So it can provide quite good information based on high contrast in soft tissues without staining, and it can provide also high resolution images as well as 3D volume and 3D data of the sample. So these are the valuable data that one can get without destroying the sample. So typical structure and typical setup of an X-ray imaging system includes a source, sample stage, and detector. Sample preparation usually is quite simple. It's just fixation, especially if you use phase contrast imaging. It doesn't even involve sample staining. So after projection at many different angles, about like 1000 to 2000 angles, one needs to go through pre-processing of images to be able to create this versatile transversal images, transversal slices. And then by stacking these transversal slices on top of each other, it is possible to create this volume data. And then it is possible to basically slice this volume data in different direction and get the information that is necessary. So how the image is created in X-ray systems are basically can be discussed and can be understood based on the interaction of X-ray beam with the sample. That can be categorized in two specific categories. One is attenuation or absorption of the X-ray beam by the sample, or by phase contrast imaging, that is the phase and the shift of the phase of the beam after passing through the sample. The first technique, attenuation or absorption, can give a lot of information about the dense, the harder or high density material inside of the sample. So if you imagine, for example, placing a hand on the beam line, you can see the bones as quite clear as they absorb a lot, and this shows high contrast inside the image. However, if you are interested in soft tissues and lower density materials, like, for example, soft tissues and tendons and vessels, that needs to be done by phase contrast imaging, and this phase shift needs to be basically translated into an image for you. So, phase contrast imaging is a very good technique for observing soft materials. However, the typical detectors that exist in the market in the field of X-ray imaging, they cannot basically detect the phase shift inside in the beam, and they usually detect the intensity and the variation in the photons that they receive. And so we need to basically get this data and then drive or conclude from this data how the phase shift happened from the intensity-based information. And there are different types of techniques to do that. And the simplest and most effective one is propagation-based imaging, which it doesn't basically involve a lot of complicated optical components, for example, gratings or crystal as it is necessary for other techniques like grating-based interferometry or analyzer-based imaging. And that makes this system quite cost effective and accessible for different applications ranging from biomedical to research. So how do we do that using propagation-based imaging is basically we place the detector a bit far away from the sample here, and we let the beam, after interacting with the sample, to pass through a free space, so it can create interferences, and these interferences can translate into the fine structures and fine components inside the sample. However, for the absorption technique, you basically place the detector closer to the sample. And if you see the comparison between absorption and phase contrast imaging of a leg of an insect, you can see that how it is possible to see all the fine structure in the leg. However, yeah, the system and the setup looks nice and looks straightforward. However, there are some challenges when it comes to using propagation-based imaging technique, and one of them is that we need quite a powerful source, and at the same time, we need to have a small spot on the source. And the way that Exciscope overcome these challenges is basically using Exilom metal jet X-ray source. This X-ray source performs a classical, overperforms or outperforms a classical solid anode X-ray source, and it's quite powerful. It can provide 160 kilovolt and 250 watt power, and it can actually provide the functionality and the performance similar to a synchrotron. So with the Exciscope polarized, you can have synchrotron like performance in your laboratory at your service. Another important case regarding phase contrast imaging is basically requirements for the software. There are a lot of basically requirements for the software, but the two most important ones that I want to share here with you is basically phase retrieval algorithm, which, as I mentioned, the detector in the X-ray system, it basically gets the information from the alteration in the photons, and this needs to be translated to the phase shift. And we need a very powerful algorithm to basically does this kind of to retrieve this information from the data that we have already. And another point is that it is very important for the software to be able to handle a large data set and perform image processing, for example, filtration or removing some noises without compromising the quality of the image. So given this information about requirements for the system of phase contrast imaging, Exciscope Polarized can provide and meet all of these requirements and can provide a unique solution for scanning soft materials with the brightest source in the market. That is the fastest basically solution for that, and it is a suitable system for laboratories with high throughput. Although the system might sound complex, but it's really easy to use and it's quite a robust system. Here I would like to discuss about some of the application examples that we ran using our Exciscope system, and together with some of our collaborators. The applications are quite vast, from scanning wood to archaeological samples or food science. But in this presentation, I brought some examples that are relevant to bioimaging. So the first example was done basically with in collaboration with KTH and Karolinska Hospital, and we studied on pancreatic cancer. of course, we did it on classical method using optical microscope, and compared it with the phase contrast microcity. So the optical microscopy and classical histology is quite common when it comes to studying on the tumors and samples that are related to patients with cancer. And the problem is that sample preparation is quite is distractive, and the information that we get from these samples is limited to 2 dimensions, and also it takes quite a long time to prepare the sample, so the patients needs to wait quite a long time between the surgery and receiving the result from how the surgery went on. On the other hand, for the phase contrast microcity images, this is quite fast. So this specific data was done within 3 hours, but this can be done even shorter in 20 minutes. And this data that we have here is based on not destroying the sample, so it was not a distractive sample preparation. The sample preserved as it was, and we could get basically isotropic 3D resolution in different direction, of course. And as I mentioned, no sample preparation was needed. In both cases, you can see some the density difference between the healthy tissues and the cancerous tissues. However, in the microcity scans, you can see some bright spots that are representing the calcification in the sample, and of course it can provide you a 3D volume of the data. Another example here would be, for example, when classical histology is not even an option. So when you have, for example, samples that are fragile or valuable, you cannot slice them and simply destroy them. One example here would be mummified hand from 2,400 years ago. And studying on such samples is quite valuable for the researchers, and the results that we can get from that can shed light on, for example, how people in the past lived, and even can provide some information about what type of disease people had in the past, and can increase our understanding how, for example, the disease right now developed over time and how we can treat them. In this specific example, when we scanned the tip of the finger using phase contrast imaging, we could see the bright area as representing as the bone, and then some soft tissues around it, and the nail on top. And there is air between nail and the soft tissue. That is because the soft tissue is dehydrated during this process of mummifying. If you look into more details of the sample, you can see the blood vessels even, and with the 3D rendering, you can choose to see or simulate the veins on top of the bones, and as well as seeing the adiopose tissues underneath the bone. And we can even, I mean, these samples and these basically results is the first kind of cellular resolution 3D images of a mummy. And these data are quite valuable, but it's not limited to this specific sample. And of course, it's possible to run measurements and scan on different types of soft materials such as wood or textile, and or anything that you basically see in the museum with the low density material. The last example that I would like to share with you is the 3D volume rendering of a piece of wood. And when you look at it, when you scan this piece of wood, you can look at it in different directions and basically virtually slice it in different directions. That can provide a lot of information about, for example, how the vessels look like inside the wood, and even can show some pores inside the wood. and this information can basically give knowledge about the quality of the wood and some properties of that, including, for example, thermal conductivity, permeability, or density of the wood. With that said, I would like to basically summarize what we discussed here, which was discussed about phase contrast X-ray imaging as a non-destructive method for scanning and creating image for soft materials and low density materials. And we discussed that propagation-based imaging is a simple and effective method for technique for basically using phase contrast imaging. And software and hardware requirements were discussed, that our solution for the hardware would be liquid metal jet source, and of course the software is quite important, and especially the algorithm, phase retrieval algorithm, it has a lot of importance, and it can add a lot of value to the result that we receive. And also we discussed about how phase contrast imaging can provide a different type of information and help researchers in different areas, specifically biomedical imaging and biomedicine. So here with that, I would like to thank for your attention, and also kindly ask you to follow us on LinkedIn. And if you have any specific question about polarized system, I would encourage you to send me an email directly or contact me on LinkedIn. And also I would like to announce that we have a special offer for as free demo scans for researchers and people who are interested in research institutes, if they would like to basically use the data as the research collaboration in the future. And yeah, with that, I am open for questions.